The World Health Organization, WHO, has warned of a rapid global increase in overweight and obesity rates among children, describing the trend as a growing public health threat and calling on schools to play a central role in addressing it by promoting healthier food environments. More details in the following report.
In a new briefing, the WHO said that the types of food and beverages provided to children in schools, as well as the wider food environment surrounding educational institutions, have a direct impact on children's physical health, academic performance, and long-term well-being. The organization stressed that schools are a critical setting for shaping healthy eating habits, given the amount of time children spend there during key stages of early development. Against this backdrop, the WHO has released new global evidence-based guidelines aimed at creating healthier food environments in and around schools. For the first time, the organization has recommended a comprehensive approach to ensure that all foods and drinks available within schools and their broader food surroundings are nutritious and supportive of children's health. The WHO emphasized that schools must take a leadership role in tackling the double burden of malnutrition, noting that while undernutrition persists in some parts of the world, rates of childhood overweight and obesity are rising sharply. According to global monitoring data cited by the organization, the number of children living with overweight has now exceeded the number of children who are underweight for the first time. The organization reiterated that obesity is classified as a chronic disease and has evolved over recent decades into a global health crisis. It noted that hundreds of millions of children receive meals at school every day, yet the nutritional quality of these meals remains insufficiently documented in many countries. The new guidelines call for mandatory standards to ensure the provision of healthy foods and beverages in schools, alongside measures to limit products high in sugar, salt, and unhealthy fats. They also recommend behaviorally informed interventions to encourage healthier choices, such as changes in food placement or pricing. The WHO cautioned that adopting policies alone is not enough, underscoring the need for effective monitoring and enforcement mechanisms to ensure consistent and sustainable implementation. While more countries are introducing school food policies, the organization warned that restrictions on marketing unhealthy foods to children remain limited in many regions. The WHO concluded that improving school nutrition is a long-term investment in the health of future generations, helping prevent chronic diseases and build healthier, more sustainable societies.